What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa and you are watching Canadian Physio Student. Alright people, so I'm back again with another video interview, and today I got an Ottawa U physiotherapy student on here. His name is Sean Stoqua. Sean, how's it going?
Not bad, man. Thanks for having me on.
Hey man, really appreciate you coming on, talking about your student experience at Ottawa. I think a lot of people will gain something from this. So
Hope so, yeah.
Really appreciate it. Anyway, so like I'm saying, Sean is going to talk a little bit about his experience at the Ottawa U physiotherapy program. I feel like I do a pretty good job about showing what the Queen's program is like. However, as you guys know, there are multiple physiotherapy programs in Canada, so I think I'd be doing a disservice if I didn't try and spotlight some of the other programs. So without further ado, Sean, you want to just tell people who you are, where you're from, education level, all that, and we can get right into the program.
For sure. What's up, guys? So, as Anthony mentioned, my name is Sean Stoqua. I'm a second-year physiotherapy student at the University of Ottawa, and I did my undergraduate education at Acadia University in Nova Scotia in kinesiology, and I'm from Ottawa as well, so I can give a little bit of background about the city of Ottawa as we go.
Perfect, perfect. All right, so first question I got for you, it's a broad one. I know it's hard to say, but how's your experience been so far at Ottawa U?
It's been great so far. I still have about 4 or 5 months of class and placements left to go, but up until this point, it's been nothing but a positive experience for a few reasons. Namely, getting to meet new faces and friends has been awesome. We're a pretty tight-knit program, and that's really been a huge advantage of our program, I'd say. Getting to live in my hometown, Ottawa, has been awesome. And then getting to experience the French side of things as well. So French isn't my first language, but getting the opportunity to go through school in French has been extremely positive for sure.
Awesome. And I was saying to Sean off camera, I thought all the students there had to have French as their first language, so I'm learning something new here too. Okay, so now we'll touch on just the brief overview of the program. So we just provide the viewers with just how the program's organized, things like that, and then we can delve a little bit more into that.
For sure. So how things work for us as second-year students is a little bit different than how it's currently working for first years. So they changed up the curriculum this past year. So as a first-year student now, what they do is they do 2 straight orthopedic classes or semesters of orthopedics to start, so you can kind of get your feet wet with the orthopedic side of things. And then they go into an observation placement, followed by an actual hands-on placement. And then the first summer is spent doing cardiorespiratory stuff. We do that at a different campus, so most of our courses take place at a building called Roger Boudon. It's attached to CHIO, the Children's Hospital in Ottawa. And then these cardiorespiratory courses often take place at our Leeds campus, which is a little bit closer to the main campus in downtown Ottawa. After that cardio-resp session, they do neurology or neuro session for that September semester, followed by 3 back-to-back placements. So that's one of the biggest changes I think they made compared to us, where our courses were a little bit mixed all the time. They've actually blocked it together now for the first-year students, where they're always doing orthopedics, or they're always doing cardio-resp, or they're always doing neuro. For us, it was more mixed, but I think it's nice now that they've blocked them together.
Yeah.
And kind of allow you to learn that stuff a little quicker. And then after those 3 back-to-back placements, they go back and kind of recap it all with class for a few months, followed by 1 last placement at the end, which is similar to us. We finished with a 2-month placement at the end of the summer, and we'll finish up at the end of August.
Nice. So it's a little bit of a different change of pace for people coming in.
Yeah, and I think it's better that way. Not that ours wasn't designed well, but I think for me personally, at least, I think it would work better to kind of be able to focus on one topic at a time, and that's the way they've set it up now.
Perfect. All right. So now moving on. We're going to address the elephant in the room, the whole French component of the program. So if you want to just address that a little bit more, because I know you're saying you're not the traditional student for the program in terms of your bilingualism.
Yeah, so as I was mentioning to you, I'm glad that I get an opportunity to speak about this to some people who might be on the fence about applying to Ottawa U, or if you've been admitted to actually decided to come to Ottawa U, because the program is French, right? All the courses are offered in French, and I guess first I'll give you guys a little background about my French, because I'm not a francophone. French is very much my second language, and as all the courses are offered in French, that can obviously be a bit intimidating, coming into the program, and a bit challenging once you're in the program. But I think the main message that I want to get across to people is that it's very doable. So even with a lack of French experience like I had coming into the program, I did French immersion in high school up until the 11th grade, but then when I went away to university, I didn't actually use my French at all. So I actually lost a lot of it over the course of those 5 years. And that's not uncommon. You'll see a lot of students not a lot of students, but I would say our program is about 2/3 Francophone and 1/3 Anglophone. And you'll see that a lot of the Anglophones are in a similar situation where they did their high school in French immersion, went away to university, maybe didn't use it as much, and then kind of regained it as they were starting school or as they were in school. So for me, personally, it was that year off after I did my undergrad where I really tried to relearn French because I lost a lot of it over the course of that 4-year undergrad.
Yeah.
And I did things like, Skype sessions with tutors, just trying to read French books, trying to make it as specific as possible to the interview at the time because half the interview is in French. So it's similar to other physio schools where it's a multiple mini interview. And half the questions are in French on the door that you have to read, so your verbal or your written comprehension, needs to be adequate to be able to read those questions, and then you need to be able to go in and speak to a professor for 5 minutes or 6 minutes in French as well. So trying to tailor it towards the interview, because if you can get through the interview and you're admitted, then you're good to go. After that point, I would not question at all if your French is adequate for the program. The interview process is meant to kind of weed that out for you. So I just want to inspire some confidence in the people out there who are maybe on the fence, who are thinking about, if that isn't for them because it might be too hard. I mean, for sure it's a challenge. All the courses are, our profs speak in French. There's 1 or 2 who actually teach the courses in English because they're Anglophone, but for the most part, 90% is French. All the slides are in French. However, the textbooks are in English.
Okay.
So that's a huge advantage for an Anglophone, right, to be able to have an English textbook where you can learn the material. And then as well, you're able to write any assignment, any paper, or any long answer question in English as well.
Okay.
So for me, that's definitely the route that I've taken. I honestly haven't written much, if at all, in French throughout this whole process. So my writing in French honestly isn't great, but my reading has certainly improved over the course of the past 1.5 years, and that's something that I'm sure other Anglophones have noticed as well. And then the other thing too is just it's enjoyable to learn a new skill. So when you do get the hang of the French and you start using it in real life situations and with your friends, it's enjoyable and you feel a little bit good about yourself.
For sure, yeah. So basically, in other words, know it for the interview, and then after that, maybe.
And then after that, you don't need it quite as much.
A little bit. Okay.
Yeah.
All right. Awesome, man. Awesome. So next question I got for you is just where have you been on placement so far? And if you want to address how much you've used your French on those placements,
sure.
that'd also be good too.
Yeah, definitely. So we do, at least how it worked for us, is we did our first 4 observational placements just 1 day a week at different private clinics or different hospitals. So we do have a little bit of input as to where our placements are. So we meet with a professor who's in charge of putting us at different clinics or different hospitals to make sure we get all our hours in certain fields. And we can ask, and we don't necessarily 100% get what we ask for, but we can ask potentially for more of an English placement than a French placement. There's a hospital in Ottawa called Montfort, and thankfully I haven't been put there because I'm an Anglophone, and that might be a little more difficult, but that's something that the professors take into consideration when they're placing you different places. So my first 2 placements were at private clinics at the west end of Ottawa, which is more English-based, generally speaking, compared to the east end, like Orleans. Yeah. So I was at Agility Physiotherapy for my first placement, which was awesome. My CI is actually a physiotherapist for Team China now.
Nice.
And my next placement was at Canada Orthopedics, where I got to shadow a concussion specialist, which was awesome. And then my last 2 placements have been at hospitals, downtown Ottawa, Elizabeth Briere, and then my most recent at the University of Ottawa Heart Institute doing some cardiology stuff.
Nice, man.
Yeah.
Awesome. So you see yourself more as a private practice kind of guy going into practice and stuff?
Yeah, I'd say so. Yeah, just with my history in sports. So I also play basketball for the University of Ottawa as well, and that's something else I guess I should speak to briefly, is just how there are some varsity athletes that are in the physiotherapy program. So as I mentioned, I play basketball. There was one girl who played women's hockey as well a year prior to me, and the professors are awesome about it. They're really understanding if you have to miss courses or miss exams for different road trips and stuff like that. So I think that's something else that's worth mentioning as well.
For sure. Yeah, and we also have some varsity athletes in our program.
Right.
So it's definitely doable if you want to use that last year of eligibility there for you.
Exactly.
Did you have 1 or 2 years left?
I still got 1 left, so
okay.
I guess it's a good time to mention that I tore my ACL as well playing basketball last year. So I missed this entire last basketball season, and I do have 1 year of eligibility remaining, which I plan on to return to use next year at school.
Nice.
So I will be done my physiotherapy degree, but I will be continuing education, doing something else next year.
Gotcha. Nice. That's awesome. All right, so moving on here now. I know a lot of people know Ottawa U as just a bilingual program, right? But what would you say is the identity of the program, if it's not that already?
Well, I think it depends if we're looking at it relative to other physiotherapy schools. So I think something that kind of gives us a bit of an identity is how small our class size is, because we're only 40 students, right? A lot of these other programs are a little bit bigger. The school size might be bigger itself, but in Ottawa, yeah, we only have 40 students. So you really get a chance, we're really a tight-knit group, you get a chance to meet and really become friends with your classmates, spend time with them in labs, spend time with them in class, and outside of class as well, you know, in those little breaks you get between courses. So I think that's something that really, I guess, identifies us, is our class size, as well as the French aspect of it as well. But more so, it's bilingual more than anything, because, you know, the francophones as well need to be able to speak English at a very high level, and to be able to read the textbooks and to use English in different clinical settings, right? So I would say the bilingualism is more of our identity, and something that our professors actually preach to us is that, look, the thing that separates you guys from all the other students is that you guys are going to graduate and be able to practice physiotherapy bilingually. So in both French and English setting, which, you know, schools from Quebec really only have the French, and the Ontario schools only have the English. So I think that's really what gives us our identity as University of Ottawa physiotherapy students.
Huge asset too. Like, even just being in Kingston, like, I see a lot of French clients, right? So it would have been nice to have that, but you know, I kind of stopped grade 9, or I stopped French in grade 9, unfortunately, but it's definitely a huge asset to have.
Yeah, and especially if you're living in the Ottawa area, right? So the Ottawa-Gatineau area, the government's there, and people are very bilingual. There's a lot of French and English-speaking people, so it's very advantageous if you want to work in that setting or in that environment, for sure.
Awesome, man. So anything else you want to say about the Ottawa U program before I ask you this last question? Or do you think you touched on?
I think I touched on most of it. I guess something for people to consider would be how we did change the curriculum, or at least how the courses were set up recently. So if you're speaking to someone about who has been in the program, just remember to take that into consideration, that it did just change this past year, so it's going to be that format going forward. And yeah, just that it's been a great experience so far. The professors have been great, students have been great, and
perfect, man, perfect. Okay, so now this is a question I ask anybody who comes on these videos. Do you have any just general last piece of advice for any future students that want to apply to physiotherapy school?
Yeah, I do actually. So something that I've been thinking about a lot lately with my injury, and as well just through doing some reading. I actually read this book recently called Desk Bound by Dr. Kelly Starrett. So some of you guys may be familiar with Kelly Starrett through Mobility WOD or Becoming a Supple Leopard. That's one of his more common books. This is one of his more recent books where he details the negative consequences of just sitting, and specifically in chairs and living a sedentary lifestyle. But I think it's more so just the sitting in chairs issue that I guess I'd like to bring to light here a little bit, because it's something that is starting to be backed up by a lot of research. The negative consequences of that, at least, are backed up by a lot of research, but not necessarily something that is being acted upon. So I guess that's something that I'd like to call on current physiotherapy students and future physiotherapy students and physiotherapists to keep that conversation going, just based on the different health, I guess, implications. So even one, for instance, like a negative consequence could be your thoracic spine is just stuck in a flexed position, after many hours of sitting, and your movement patterns are just formed around that, and it can really take a toll down the road, not just for orthopedic issues, but also for swelling management, for pain management, for obesity management. So honestly, it's a long conversation that goes outside the scope of this interview, but I think it's something that I'd like future physio students to continue the conversation going, and spend more time standing as we're doing now.
We're doing it.
Yeah, exactly. Spend more time standing. Keep that lymphatic system on, and even spending time sitting on the floor is something that Kelly notes is a little more advantageous to sitting in a chair, as you can actually achieve proper pelvis stabilization and a better spinal position when you're sitting on the floor versus a chair. So yeah, that's the last thing I guess I'd like to mention.
No, that's awesome, because all that's going to be relevant for any of these students who want to pursue physiotherapy. You see it in the clinic all the time.
For sure, yeah. I'm sure you've seen probably a lot of people coming in with different orthopedic desk workers, or it's I guess one of the most dangerous jobs now. It's almost equivalent to a construction worker, yeah, like in terms of the amount of injuries that they incur. So if we can raise awareness to this, maybe we can help prevent some of those orthopedic injuries that just result from sitting at a desk all day, and put our time and effort towards more significant injuries.
Definitely. Awesome, man. Well, I think that wraps it up. Anything else to say, or are you pretty much good here?
No, I think that's it. Yeah.
All right, perfect.
Yeah, go GGs.
Yeah, appreciate
Thanks
you
a lot for having me on, man. I appreciate it a lot.
Yeah, did you want to leave some contact information, just if anybody wants to reach you?
Yeah, you can reach me on Instagram at just Sean Stoqua, and you can also send me an email if you have any questions at stoquasean@gmail.com.
All right, it'll all be in the description or on the screen here somewhere, okay? All right, guys, so if you like this video, make sure to like, share, and of course, smash that subscribe button, and I'll see you at the next video.
Another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.